everyone. Welcome to week 4, chapter 17. We had a nice break, so I'm excited to get into some new topics. So we're going to talk about the electronic health record. And this is obviously an important issue because many places are, if not already, rolling out the use of the electronic health record and its importance. So we're going to talk about that. So today we're going to describe the common components of an electronic health record, assess the benefits of implementing an electronic health record, explore the ownership of electronic health record, and evaluate the flexibility of the electronic health record in meeting the needs of clinicians and patients. And something else that we're going to discuss is the meaningful use in electronic health records, because, when they first really started rolling out using electronic health records, at least the main part that I remembered was just the idea that orders were put in electronically because it was going to decrease in medical errors. And that's kind of how it started, and then it went into charting, and then they found that you could do trends and you can do quality improvement by pulling data. And so it grew into something more. And I'm sure, obviously, the whole centralization of information was very important, but from the starting point, I swear that just the idea of being able to read each other's handwriting was the main objective. All right. Push for electronic health records. So in 2004, President Bush raised the profile of electronic health records in a State of the Union address by outlining a plan to ensure that most Americans would have an electronic health record by 2014. And this goal was reaffirmed by President Obama. So the Affordable Recovery Reinvestment Act of 2009 included the High-Tech Act to specifically incentivize health organizations and providers to become meaningful users in EHR. So when we talk about meaningful users, so when some of you can attest to this, when electronic health records first started out, it was very simple things like, okay, a face sheet, or you printed out labels and then you put in orders, and it was more organized. And instead of when you wrote lab orders, you had to make a lab requisition form, it just went directly to the lab. Little simple things like that. But meaningful use goes a lot deeper than just maybe recording, keeping things neat. There's a lot of facets to it. I'm just going to tell you a few of them now, and you'll slowly learn them as we discuss more in this chapter and the rest of class. So one of the things is meaningful use in terms of meaningful utilization aside from just a form of documentation. It's not just a diary, right? It's a live breathing organism, as we know these EHRs are. And the ability to pass on information, centralize information is important. However, there's so much more. What about the fact that we use our EHR now to improve quality measures? We get warnings. Someone hasn't had their, medication. It's late. It is a living, breathing, real-time organism that helps with improving the standard of care. And the meaningful use, you get money for it because if you meaningfully use your EHR, it means you're improving care and safety with patients. So pulling data to figure out where you have care gaps with diabetes, pulling data to figure out, certain health trends, how we find that, Asian women have a higher risk for osteoporosis because we pull these trends through the computer and assess them in the studies. It implements studies so much faster. So meaningful use is not just charting, right? There's so much more to it, and we're going to talk about that. So providers and hospitals must use a certified EHR that meets a set of standard functional definitions to be eligible for the increased reimbursement incentive. So there are two different organizations. There's the Drummond Group and Certification Commission for Health Information Technology. So it was developed by the National Institute of Standards and Technology, which is basically this institute is involved with all the EHR measures, and it's endorsed by the Office of the National Coordinator for Health Information Technologies for EHR. So it's such a big deal to have this safe, meaningful medical documentation that there's actually a national institute for it. So 45 certification criteria is ranging from basic stuff, right? So you can record and update patient demographics, document vital signs, maintain up-to-date problem lists, to more complex stuff such as electronic exchange of clinical information and patient summary records. So, for example, this is really important. So Cincinnati, Ohio has a high rate of syphilis, and it's, can be a really dangerous disease if not treated. And so finding out past treatment is important in order to figure out if someone newly needs to be treated or not. And with this centralization of clinical information, that the information's at our fingertips. So electronic health registry, it's not just a medical record now. It's actually a data warehouse, which is how you picture it, except that it's in the cloud, and it's a warehouse of all this data in real time. And there's information regarding the health status of a client, and it replaces the former paper-based medical record. So you move faster. Information moves so quickly now. And with paper, we couldn't keep up. And, the healthcare issues aren't going to slow down just because we're using paper. So the amount of people going to the ER after they saw their doctor, that hasn't changed. But now the ability to treat someone better has changed. So it's systematic documentation of a client's health status and healthcare in a secure digital format. So it can be processed, stored, transmitted, and accessed by those who are authorized to use it to support efficient, high-quality healthcare. So here's some essential components when we talk about the EHR. Health information and data. So the patient data is required to make sound clinical decisions, including demographics, medical and nursing diagnosis, medication lists, allergies, and test results. So important, these test results. I mean, I want you guys to just think pathophysiologically, sorry. You get someone who comes into your office and they have high blood pressure, okay? Before, you would try to get someone's medical records, and you usually could, but there was a lot that was missing. If you didn't have someone's recent laboratory results and they come in with high blood pressure and someone doesn't know the nitty-gritty about their medical history, and this isn't just like people who are illiterate with health. This is most people. I can't tell you my last cholesterol reading. I just know that it was normal, okay? So when you ask someone, how are your kidneys functioning? Do you know your last creatinine? Do you think they're going to know that, even if they're really educated? Probably not, okay? So you have to make this decision. What blood pressure medicine I'm going to start you on? And if you have any forms of kidney insufficiency, you're not going to get started on certain medication because you could die. You could go into renal failure. But some of the medicines that you would then be like, okay, well, Denise, I'll just avoid them. I'm not going to give it to that patient because I don't know what their kidney function is. Well, the other options that are out there that don't affect the kidney aren't as good as the other ones. So up-to-date, real-time medical data is super important. Results management, this ability to manage results of all types electronically, including lab and procedure reports. And you would think, oh, okay, Denise, this sounds like the same thing. But no, it's the quick exchange of information when you order something and knowing that something gets done. And so this involves, yes, okay, you get your labs back and they're in an organized fashion on the computer. That's wonderful, right? We can all agree to that. There's nothing worse than waiting for that printout and then having to look at the printout, which was really messy and not in grid formation. But also what's wonderful is we're reading x-rays on our computer. I can read my lab results over my phone when I'm at home if something's urgent. And so it's a better way for result management. And also, again, taking care of issues in real time. All right, order entry management obviously is amazing, right? I can't tell you how many times I had to get on the phone and call a doctor in the middle of the night and say, I can't read your handwriting. Do you mean milligrams or micrograms? Did you really mean 125 milligrams of hydralazine, or did you mean 12.5 milligrams of hydralazine? Because that's the usual number. And then, of course, the doctors will get mad at you and scream at you and then, of course, correct what they had to say. And it was the worst. So order entry management, but then also think about this. I go to, say you go to the emergency room. You come in and you complain about a headache. There's long waits in the emergency room and there are shifts in the emergency room. So you come in, they draw all these labs, time goes by, a new shift comes on, and they're like, oh, we need to get this lab. Instead of having to flip through papers to make sure it was done, really easy, you can find it there. What radiology was done? Okay, here's a great example. I had someone who came in the day before they had gone to the ER because she thought she was pregnant, which is a total misuse of the ER, but that's beside the point. And she wanted me to get a pregnancy test. And I was going to get it, and then I looked, and I'm like, well, you weren't pregnant yesterday, so, and it's still too early, you know, it probably won't come back, so we can do a blood pregnancy test. It's just, you know, put this poor girl's mind to rest once and for all. Or someone thinks they have syphilis, or I'm sorry, gonorrhea, and their test the day before was negative. Well, you know, you might change the way you clinically take care of that patient. And then there's decision support, which is really important. Decision support is the computer reminder and alerts to improve diagnosis and care of patient. So this is a great example. On my charts, the computer sees the BMI and will say, you don't have on their problem list obesity or overweight or underweight. When you have a diagnosis of obesity, it's going to A, support some of the stuff you're doing for reimbursement, but two, it's going to remind you, it's going to click into the computer and say, okay, if this person is obese and they're over the age of 30, then you're going to do the A1C screening early to check for diabetes. You might want to send them to a weight loss class. If somebody smokes, it sends you a reminder, hey, did you offer them a quitting aid? Did you offer them a social support system so that they can quit smoking? The decision support is great, and they do it for nurses as well. Hey, we see that there's restraints ordered in the computer. You either need to document on it, get the order renewed, or you need to discontinue the use of restraints and document that. And that's part of that meaningful use, utilizing the EMR to better serve yourself and serve your patient. Electronic communication and connectivity is the online communication among healthcare team members, their care partners, and patients, including email, web messaging, and an integrated health record within and across settings, institutions, and telemedicine. Okay, nothing is worse than when someone just recently went somewhere that doesn't use your program of EMR. And at some point, they're going to talk about connecting all the different EMR systems across software. So we use Epic. The main hospitals in Cincinnati and health groups use Epic, but the smaller groups don't. They were going to use the ones that are most affordable but still effective, and you can't connect into them, and that is definitely hard. But it definitely cuts back on the amount of paperwork that you're going to be searching for. Patient support. Patient education and self-monitoring tools. So we have MyChart, there's home telemonitoring, telehealth systems, better patient education. Within your EMR embedded is lots of education options for your patients. You can also download programs into your patients' phones, and they can input their blood sugars, their weight, and it can go directly into their chart. And then you can get a note about it. Those are very expensive components to EMR. Most places don't do it, but they're working on it and trying to make it more affordable. Administrative processes, so electronic scheduling, billing, claims management systems, phone calls that come in from patients. Scheduling inpatient, outpatient is great. You can self-schedule yourself in terms of your staffing, and that you're constantly in real time updating what staff is available to accommodate what acuity of patients. Scheduling procedures, electronic insurance eligibility, so that's up there. And what's great is, okay, I know what insurance someone has on my computer when they sit down. And on top of it, their insurance company will alert me when something isn't covered. So that might mean I'm going to change the way I treat them, or I know ahead of time I'm going to have to call their insurance company and get some clearance before I send someone a hefty bill for a test. Identification of possible research study participants, and drug recall support, which is really important. It's really hard. You know, when I see drug recall support, I used to just stay up at night thinking, oh my gosh, how am I going to find out who's on this? Well, your EMR helps you out with that. And reporting and population health management. This is really important so that we can move forward in healthcare. So it's data collection tools and supports public and private reporting requirements. You can find out how you're improving and look at processes as well to see what needs to be adjusted so that you can offer your patient the highest standard of care. So really quick, we're going to watch a video on the electronic health record and meaningful use.
If you're like most doctors, you've probably heard something about a government incentive program encouraging physicians to implement electronic health records. However, you're probably a little fuzzy on the details. Well, you're not alone. Let's take a closer look and see if we can help you make sense of it all. On February 17, 2009, the American Recovery and Reinvestment Act, also known as the stimulus package, was signed by President Obama into law. Contained within its pages is new legislation known as the Health Information Technology for Economic and Clinical Health Act. That's a mouthful, so we'll just call it the High-Tech Act. So what exactly is the High-Tech Act, and how does it affect you, a physician? Well, very simply, it uses financial incentives to encourage physicians to adopt certified electronic health records, or EHRs. Through the increased use of EHRs, the government hopes to achieve the goal of a national health information network that will result in improved quality of care, patient safety, and lower costs. What kind of financial incentives are we talking about here? Perhaps as much as $34 billion. So now you're probably asking yourself two questions. One, how do I qualify for this money? And two, just how much of that $34 billion is available to me? Well, the answers to both of these questions are actually quite simple. To qualify for a piece of the high-tech money, there are two things you will need to do. First, your practice must purchase and use a government-certified EHR. Secondly, your practice will need to demonstrate meaningful use of this EHR. This means that you will have to prove to the government that the EHR is being properly implemented according to their criteria. This criteria is detailed in a list of 25 requirements issued by the Department of Health and Human Services and is broken down into two sets of objectives and measures: a core set and a menu set. The core set consists of 15 non-negotiable objectives that all physicians must comply with. In the menu set, however, providers are free to choose 5 items from among a menu of 10 to implement. In all, this means physicians must meet 20 total objectives in order to demonstrate meaningful use. Fail to meet even one of these meaningful use requirements, and you become ineligible for the incentives. Now that you know how to qualify, let's find out how much of that $34 billion you can get your hands on. The answer to this depends on which incentive program you are eligible for. High-Tech provides 2 separate programs, one for Medicare and one for Medicaid. With Medicare, physicians can earn up to 75% of their Medicare allowable charges, up to a maximum of $44,000. With Medicaid, close to $64,000 is available to physicians who see more than 30% of Medicaid patients. That number is reduced to 20% if you're a pediatrician. Keep in mind, this incentive is for each eligible provider within a practice. For example, have 5 providers on the Medicaid program, and your practice can receive up to $320,000 in incentive funds. Unfortunately, though, the High-Tech Act is not just about handing out free money. Delay, or even decide not to implement a certified EHR, and you will be penalized. Not only will you lose out on the incentives, but the government will also begin decreasing your reimbursement rates by as early as 2012. So as you can see, at its core, the High-Tech Act is not that complicated at all. Simply purchase and use a government-certified EHR, meet all of the meaningful use requirements, and you'll be eligible for the high-tech incentives. And on a final note, be aware of the fact that commercial insurance carriers are already talking about jumping on the meaningful use bandwagon and requiring providers to meet the same criteria for their pay-for-performance programs. Hopefully this has given you a clearer understanding of the High-Tech Act and what it means to you and your practice. Over the next several years, EHRs will change the way we as healthcare providers keep patient records. Change is coming fast. Act now to make sure that you don't miss out on your portion of the high-tech money.
All right. Oh, sorry. Okay. I'm like, where do I go next? All right, so I would like to embed a link for you guys. Let me figure that out. All right, I figured it out. I'm going to put a link up so you can watch this video again on your own time if you want.